So we're going to start with the clavicle, or the collarbone. So the collarbone actually sits like this in the body. This portion attaches to the manubrium of the sternum, and this part that flattens out is actually going to make contact with the acromion process of the scapula, and that's what makes up the top portion of your shoulder that you feel. So this is the clavicle. The clavicle is the collarbones. So this is the scapula, sometimes called your shoulder blade. This is the posterior aspect of the shoulder blade that we see in this view here. One of the first things that you should notice is this big structure here. Okay. From here to about here, this is the spine of the scapula, or scapular spine. The spine of the scapula, or scapular spine. Once we get to about here, that structure continues, but it flattens out and turns. Okay, so this portion would still be spine of the scapula, or scapular spine, and then it's going to change shape into this large structure here called the acromion process. Acromion process. You might remember that the shoulder region is the acromial region. Okay, that might assist you there. All right, let's go ahead and flip this over to an anterior view now. Now you'll notice that the anterior view is smooth. This portion of the scapula is going to butt up against the rib cage on the back. So you'll notice I have this kind of interesting looking thing. Do you see how it looks like a raven? Here's the raven, there's the big old beak. But this structure, it means raven's beak. The term that we use for this in anatomy is the coracoid process. Coracoid process of the scapula. I think of a witch with a crooked finger just going, ah, my pretty. Okay, because it looks like a witch's finger to me. Crooked for coracoid, crooked, coracoid. And I think of a raven on her shoulder. The last structure that you need to know makes up part of the shoulder joint. This is the medial end. This makes up part of your shoulder joint. See how flimsy this is? There's not a lot of structure to it. This is the glenoid cavity. Now, sometimes this is referred to as the glenoid fossa because it's just such a shallow bowl. But I kind of prefer cavity because it forms the shoulder joint, the glenoid cavity. So glenoid cavity, coracoid process, spine of the scapula, and acromion process. Now the humerus. This is the head of the humerus. So it's rather large, the head of the humerus. And this large head of the humerus articulates with this flimsy glenoid cavity to form the shoulder joint. So we get a lot of mobility, not a lot of stability. That's the trade-off there. So first of all, this is the anterior view. The anterior view. I know that for a couple of different reasons. The first reason is I have this little thing, this little structure that's sticking up right here. This is actually the lesser tubercle of the humerus. So that's one clue that I am anterior on this. The other clue is this structure down here, which is called the capitulum. And the capitulum can only be seen anteriorly as well. Okay, so the capitulum of the humerus. So if I were to flip this over to the posterior aspect, I no longer see the capitulum and I can no longer see the lesser tubercle. For the humerus, probably one of the more obvious structures here is going to be the head. Okay, so this is the head of the humerus. Now this is the front view, and the lesser tubercle of the humerus, which is right here, it's very pronounced, so you can see it's got a little shadow here. So it's very pronounced, but it's a lot smaller than this much larger portion right here. See this? This is the greater tubercle. So lesser tubercle just right here, and greater tubercle. Right? Now, if I continue to go around, the greater tubercle is indeed great. Okay, this whole thing is the greater tubercle. This is actually the lesser tubercle here. Okay, so there's that. So just so you can see it as I'm turning it. Okay, so the lesser tubercle sticks out quite a bit. But this whole thing that sticks out less and is less noticeable is the greater tubercle of the humerus. So greater tubercle of the humerus, lesser tubercle of the humerus. If I continue to go around, I can only see the greater tubercle. I can no longer see the lesser tubercle because it's hiding down there. Okay, and there's the head of the humerus. So I mentioned already the capitulum. So this structure here is the capitulum. Capitulum actually means a little bald round head. Little bald round head. Capitulum. So that's kind of what it looks like. I'm going to see if I can give you any better views here with some better shading or whatever. There we go. That's a little bit better. So see that? Capitulum. Right. Now next to the capitulum, I have this from here to here. I have this kind of saddle. Kind of looks like a saddle or maybe a spool of thread. This entire structure is called the trochlea of the humerus. The trochlea of the humerus. So I've got the capitulum of the humerus and the trochlea of the humerus. So it usually doesn't have a hole, but this structure here, there is a divot here, okay, a fossa. And this is the coronoid fossa. Not coracoid like we see in the shoulder, but coronoid. So just think about how annoying it is when you hit your funny bone. You hit your elbow right there, and it's not very funny. That is the coronoid fossa. Remember, fossa means shallow bowl. Coronoid fossa of the humerus, trochlea of the humerus, capitulum of the humerus. Flipping this dude around, we can still see the trochlea. There's no capitulum though that can be seen. Okay. And I have a deeper divot on this side. This is the olecranon fossa. You might remember I was calling the olecranal region the nooks and crannies. You know, saying that the back of an old woman's elbow like mine looks like a bunch of nooks and crannies. Okay, like a English muffins. Olecranal, okay, olecranon. That's where it gets its name because it's part of olecranal region. So this is the olecranon fossa. This lies at the back of the elbow. Okay, so let's just go through it again. Head of the humerus, lesser tubercle of the humerus, greater tubercle of the humerus, capitulum of the humerus, trochlea of the humerus, coronoid fossa of the humerus, olecranon fossa of the humerus. The next bone is kind of nice. This bone is nice because it gives you a hint on what its name is. Isn't that nice? So it gives you a hint by saying, my name starts with the letter U. See that? U. Meaning, this is your ulna. This is the ulna. Now, the ulna is going to actually rock back and forth on the trochlea of the humerus, like so. All right. Feel the back of your elbow. What you think of your elbow as the elbow bone is not your elbow bone. You don't have an elbow bone. What you're actually feeling is this. You're feeling the olecranon process of the ulna. Okay? So the olecranon process of the ulna is going to fit into the olecranon fossa of the humerus when the arm is fully extended. Okay? So, olecranon process of the ulna and olecranon fossa of the humerus. Okay. Now you may have noticed that this U shape here of the ulna rocks back and forth on the trochlea here. Okay? So, for that reason, we call this inner area of the U shape here the trochlear notch of the ulna. So this is the trochlear notch of the ulna, which is going to rock back and forth on the trochlea of the humerus. Okay. Now, if I bend my arm, if I were to bend it as much as it would go, all you can see is my hand. Okay, let me try it down here. All right, so eventually I'm going to get to a point where they're going to meet. Okay, where they're going to meet is, this is the coronoid fossa of the humerus, and this, where it articulates when you are bending your elbow fully, this is the coronoid process of the ulna. So coronoid process of the ulna articulates with the coronoid fossa of the humerus when the arm's fully flexed. All right, so for the ulna, the three things that you need to know are the olecranon process of the ulna, the trochlear notch of the ulna, and the coronoid process of the ulna. But that's only half of the picture. It's a compound joint. The reason is because I have the radius too. The head of the radius articulates with the capitulum of the humerus. So the head of the radius is kind of funky looking. It's just this kind of weird little plate that has a shallow indentation. But this articulates with the capitulum. You need the head of the radius. And the other structure is this little bump right here. This is called the radial tuberosity. The radial tuberosity. Now for the hands, I'm going to give you guys a little bit of a break. For my class, you do not need to know every single name for every single wrist bone. Okay. Instead, we're going to go generic and call them by their generic names. Collectively, I can call all of these bones carpals. You might remember that the carpal region is the region of the wrist. Okay, think carpal tunnel syndrome. All right. So these are the carpals. We have 8 little carpal bones here. Now the bones of the hand, so some people will look at this and they'll think this is the palm and that we have really long fingers, and that's actually not the case. This is really, or not too much smaller than my own hand here. These first bones here, so these are the bones of the wrist. These bones are bones of the palm in the back of the hand. Your fingers are not until here, okay? So these bones are really friendly. All right, these are the carpals, and these are the metacarpals. They're really friendly. They like to meet for coffee. All right, so carpals, metacarpals. Beyond that, we can go generic again with the bones of the digits, and this includes fingers and toes. And all of our fingers are going to have 3 phalanges. For our thumb is going to have just 2. All right, so these are the phalanges. So carpals, metacarpals, and phalanges. So I want you to think of this structure as a really demented Mickey mask, okay? So Mickey's ear has to be facing up, right? So Mickey's ear has to be facing up, and this would be his mask, right? So that's where his eye would be. So you want it somewhat like so, just to help you kind of orient yourself. This portion right here is the pubic symphysis. This is where the 2 hip bones would join together. So for that reason, the area that's just from here to here, okay, so do you see how it kind of maybe looks like an evil Mickey? Like here's the arch of his eyebrow and he's right? Maybe not. Okay, so this is the evil eyebrow. This is the pubis. The pubis, just from here to here. Okay, the pubis. His eyes have these big bags underneath them. All right, his eyes are very red and he wants to ischium. All right, so this is the ischium of the pelvic bone. Okay, so pubis, ischium. Now, what about the ear of Mickey? What do we call that? The ear of Mickey is the ilium. So the entire portion here, the ilium. And I could point to it from this side or this side. Okay. So this big flat piece here is the ilium. The ilium. If you were to put your hands on your hips, you would actually be resting your hands on this portion of the ilium here called the iliac crest. Iliac crest, the iliac crest. All right, so iliac crest, ilium, ischium, pubis. Another way to think of the pubis is look for this kind of sharp angle here. That's part of the pubis. The smooth portion is the ischium. All right. Now I have two more structures to show you. First of all, let's go ahead and name what this hole is here. For this hole, see how it's really big? Maybe you're dialing O for the operator. Okay, so just think O. Think operator because this is the obturator foramen. Foramen meaning hole. Okay, obturator foramen. Okay. And then we have this large socket here for the hip bone. Okay, a lot more generous than what we see in the shoulder. And this is the acetabulum, okay, or acetabulum, sometimes referred to as the acetabulum or acetabulum. Obturator foramen, acetabulum, ilium, iliac crest, pubis, ischium. Just so you have an idea of how your hip joint comes together. So this would be your hip joint. So the head of the femur sits in the acetabulum or acetabulum of the pelvic bone. This is the femur. You might remember the area of the thigh is the femoral region. So the most obvious one here is probably, let me go ahead and let's zoom in a little bit so we can see these structures a little better. Here is the head of the femur. Head of the femur or femoral head's fine. Okay. Then I have this kind of narrowing part here. This is considered the neck of the femur. The neck of the femur. And then I have this large structure here called the greater trochanter. This is the greater trochanter of the femur. Okay. The lesser trochanter, I can see just a tiny little bit of it from this view. I can see it in all its glory when I flip this guy over. Okay, this is actually the anterior view we're at right now. But that is the lesser, the lesser tubercle, which is right there. And if I look at this side, I can see that it has kind of this smooth surface right here. And this is actually where the patella is going to rub back and forth. The patella is considered a sesamoid bone. Sesamoid because it's embedded in a tendon. So when you move your knee, this is actually going to kind of act like a moving shield. Okay, so if you're wondering how do I know whether I'm anterior or posterior on this, the easiest way I think is I can see that there's either a smooth surface here, or when I turn this around, it looks very, very different. This is the back of the knee. All right, so let's go ahead and look at the structures as we can see them on this side, the posterior view now. So this is the head of the femur, the neck of the femur, the greater trochanter, lesser trochanter, and at this point we just call it either medial condyle or lateral condyle. So the question is, well, which is which? So the head, now this is attached to the body, right? All right, because so you can walk. All right, so the head is going to be on the medial side. So whatever side is the medial side is going to have the head on it. That means this will be the medial condyle of the femur. So medial condyle of the femur and lateral condyle of the femur. I could also ask for it like this. It doesn't need to be on the posterior edge. The medial condyle of the femur, okay, and the lateral condyle of the femur. Now I could just ask you for the patella. If I do, it's just going to look like that. All right, it's just going to say name the bone. So if you get something that looks like a rock, just go for patella. Right. This one has the patella attached. Not all of them do. So this is the proximal end, and this would articulate like so. All right. Now what's kind of cool is let's see where the head is. So the head's on that side. That means this is medial. And so this is the medial condyle of the femur, and this is going to be the medial condyle of the tibia. This is the lateral condyle of the femur and the lateral condyle of the tibia. Okay. All right, well that's fine if I have the femur around, but what if I don't? Okay. What if I don't have the femur around and I'm just looking at a picture that looks like this in a practical exam? What you want to do then is you want to identify this structure right here. See this notable structure here? This is the medial malleolus of the tibia. The medial malleolus of the tibia. The medial malleolus of the tibia is going to be on the medial side, hence its name. Medial malleolus, that means this is the medial condyle over here. And this would be the lateral condyle, the lateral condyle. Now this could also be flipped over, doesn't matter. As long as you can identify where this medial malleolus is, which is right here, then you can say, well, this has got to be the medial condyle and the lateral condyle of the tibia. And just so you know, this is kind of how it looks from this view. That's the fibula. Okay, so when you're feeling the outside bone on the outer ankle, you're feeling your fibula right here. And when you're feeling the bump on the inside of your ankle, you're feeling the medial malleolus of the tibia. So the fibula doesn't have any structures that you need to know. You need to be able to recognize it. If it comes up, it'll just look something like this, and it'll just say, what is the bone? Okay, and that's the fibula. So remember, tibia, fibula, tibia, fibula. All right, moving right along at lightning speed. Next, we have the bones of the foot. Okay. And again, we get a little bit of a break because we're going to go generic with a lot of these. Technically speaking, so remember that the bones of the wrist are all carpals. The bones that make up the ankle joint here are technically all tarsals, but there's two that I want you to know the names of specifically. The rest of these, you could just simply say tarsals. Tarsals. Okay. Now here's the true ankle bone. The ankle bone is not palpable or feelable from the outside. And the reason is because I've got that medial malleolus on one side, I've got the fibula on the other, so it's nestled in there. But your true ankle bone here is called the talus. T-A-L-U-S. The talus. Okay. And for the tarsals, just think of somebody having tarsals or tassels on their feet, like in a powwow. Got the little bells and tassels and the ching, ching, ching. Okay. So tarsals, talus, and the largest bone of the foot is the calcaneus. This is the heel bone. Calcaneus. You might remember calcaneal is the heel. So the calcaneal area is the area of the heel, right? So calcaneus. So this is the calcaneus bone. So calcaneus, talus, these are all tarsals, which makes these the metatarsals. So these are the bones of the arch of the foot. Okay, tarsals. I'm sorry, metatarsals. And then lastly, the phalanges. Even the pinky toe, which is super, super tiny. How cute is that? Look at your little tiny bones here. You actually have 3 phalanges here. 1, 2, 3. Okay, so even your little pinky toe has 3 phalanges, and the big toe only has 2, just like the thumb. So all of the bones of the digits can just generically be called the phalanges. All right, so phalanges, metatarsals, tarsals, talus, and calcaneus. Okay, how you feeling?